Can you get pregnant if you have endometriosis? If you have this question, you're not alone. Hi everyone, my name is Dr. Bebahani. I'm a board-certified reproductive endocrinology and infertility specialist, as well as a minimally invasive GYN surgeon. I have many patients who I've treated who've had endometriosis, and I want to share with you some important things that I tell my patients every day. So the good news is, yes, many people with endometriosis will get pregnant. But the caveat is, it can be harder to get pregnant with endometriosis. Sometimes women with endometriosis may conceive naturally, and sometimes they may need help with fertility treatment. But what is it about endometriosis that makes it harder to get pregnant? Endometriosis is a chronic condition in which tissue similar to the lining of the uterus grows outside the uterus. This tissue can be found on the ovaries, on the tubes, and around other organs in the pelvis, such as the bowel and the bladder. Even though the tissue is living outside the uterus, it still responds to hormone changes during a woman's monthly cycle. This means that the tissue outside the uterus is still thickening, breaking down, and bleeding just like uterine lining tissue, which happens every month with a menstrual cycle. However, because that tissue is trapped inside the body, it has nowhere to go. It cannot come out of the uterus like a normal menstrual cycle. That tissue gets stuck in those implants, which leads to inflammation, scarring, and if it's on the ovary itself, it will form deep infiltrative endometriosis of the ovary, otherwise known as an endometrioma or a chocolate cyst. Endometriosis can affect a woman's fertility in several ways. One of the most common problems is that endometriosis causes a lot of scar tissue to develop, and that scar tissue can block or damage a fallopian tube. Fallopian tubes are necessary for the eggs to travel from the ovaries to the uterus, and if the fallopian tubes are blocked, or if they're stuck to other organs because of scar tissue, then those fallopian tubes are not functioning the way they should, and it becomes really hard for the sperm to meet the egg. If the sperm does not meet the egg, then the egg does not fertilize and an embryo is not created, and that embryo cannot travel and make its way safely to the uterine cavity. Another way endometriosis can impact fertility is by affecting the health and the function of the ovaries. The constant inflammation caused by endometriosis may damage the environment where the eggs develop, leading to fewer healthy eggs being released during ovulation. Endometriosis can also affect the quality of the egg even if the endometriotic implant is not on the ovary itself. So endometriosis of the pelvis, whether it's on the bowel, on the bladder, on the diaphragm, in the upper abdominal cavity, any endometriotic implant that produces inflammation can affect an embryo that's trying to stick and can reduce implantation rates and can affect egg quality. We see that in IVF patients who have endometriosis, where their egg quality may be affected by the endometriotic implants that are present in the pelvis. Endometriosis may also create a less welcoming environment in the uterus for a fertilized egg, making it harder for implantation to occur. Although endometriosis can create obstacles to becoming pregnant, many women with mild or moderate endometriosis are still able to get pregnant naturally, though it may take longer than usual sometimes. Research suggests that between 30 to 50% of women with endometriosis may experience difficulties getting pregnant, but that means that 70% of women can still get pregnant naturally. Natural conception is still very possible, especially if fallopian tubes are not blocked and ovulation is occurring regularly. For women who are unable to conceive naturally, there are several fertility treatment options that can help. Surgery is actually the only way to diagnose and treat endometriosis. We can suspect endometriosis based on patient symptoms or based on imaging findings, but the only way to confirm the absence or presence of endometriosis is surgery. Surgery allows us to look with our eyes and see what the tissue inside the pelvis looks like. It allows us to remove the implants and have a pathologist look under the microscope and confirm the presence or absence of endometrial glands and stroma, which is what diagnoses endometriosis. For this reason, we cannot diagnose endometriosis just based on imaging finding. We need pathology or tissue diagnosis to confirm the presence of endometriosis. This is why when couples are trying to get pregnant, if we suspect endometriosis based on ultrasound or based on symptoms, the next best step should be surgery to confirm the diagnosis and remove the disease. Removing the endometriotic implants can help improve not only natural pregnancy rates, but also pregnancy chances with IVF. Because as mentioned before, endometriosis of the pelvis can affect the egg quality and can affect implantation rates even with IVF. For that reason, Surgery needs to happen first so we can confirm the diagnosis, we can treat the endometriosis, and we can give the couple a chance at natural pregnancy. If natural pregnancy does not occur, then there are always ways to help women get pregnant through IVF or IUI. The type of surgery we do is usually done laparoscopically with small incisions. This is a minimally invasive procedure where the incisions are made on the abdominal wall and special instruments are used to remove the endometriotic implants that are identified in the pelvis. For women with endometriosis, surgery can improve the chances of natural pregnancy. But surgery is not always the first choice for everyone. If women have large ovarian cysts on their ovaries, then removing those cysts can decrease ovarian reserve, which means that the number of eggs available for ovulation may decline. Because of this, it is very important that you have a thorough discussion with your fertility doctor on whether or not surgery is the best option for you. Occasionally, we may have to go through IVF first to retrieve those eggs, because we know that with surgery, the egg count may drop. And with IVF, we're trying to get every single egg that the woman has available to create the embryos with. If we do IVF first and we retrieve those eggs and we create embryos, we don't have to do an embryo transfer right away. We can freeze those embryos, do the surgery to remove and treat the endometriosis, then proceed with an embryo transfer. The decision to do surgery first or do IVF first is very individualized. It depends on the woman's ovarian reserve, and one test that we commonly ask for in women who are trying to get pregnant is an AMH, anti-Müllerian hormone. That test is a specific test that helps us evaluate the woman's ability to produce eggs and help us gauge how many eggs are available on the ovary. So based on that AMH testing, your doctor may decide to do surgery first or do IVF first to create those embryos before doing surgery. For women who have endometriosis but are not ready to try for a baby yet, egg freezing may be a good option to consider. Since endometriosis can worsen over time and possibly reduce egg quality and quantity, some women choose to freeze eggs when they are younger and their eggs are healthier, giving them a better chance of having biological children in the future. For women who don't get pregnant naturally, who are ovulating and still struggling to conceive, intrauterine insemination or IUI may be a recommended option. IUI is a procedure where sperm is placed directly into the uterus around the time of ovulation, and this makes it easier for the sperm and the egg to meet. In cases where other treatment options have not worked, IVF or in vitro fertilization is often the best option. IVF involves retrieving eggs from the ovaries, fertilizing them with sperm in a lab, and then placing the embryos directly into the uterus. Because IVF does not require the fallopian tubes to be open, it is an excellent option for women whose tubes are blocked or severely damaged by endometriosis. So having endometriosis does not mean that pregnancy is impossible. Many women with this condition go on to have healthy pregnancies, both naturally and with medical help. However, because endometriosis affects fertility in different ways, it is still important to work with a fertility specialist to create a plan that is right for your body and for your goals. I hope you found this helpful, and remember to subscribe below, and we will see you in the next video.